Okay, we will make a start. I know that some people are still having trouble getting in, and we will be working on that in the background. But thank you to all who could come to join us for this webinar, The Health and Social Impacts of Long-Term Evacuation Due to Natural Disasters. My name is Margaret Harris-Brockman. I'm the Senior Program Manager at the National Collaborating Center for Infectious Diseases. NCCID and all of the NCCs for Public Health are funded by the Public Health Agency of Canada to provide knowledge and evidence for use in public health planning and policy. NCCID is hosted by the University of Manitoba, which is on the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and on the homeland of the Métis Nation. There are a few housekeeping items I'd like to mention. Today's event is a moderated discussion, so we are running this webinar through Zoom. If you have any further troubles with Zoom, please contact us at nccid@umanitoba.ca. You can use the question and answer function during this session to submit questions for the panelists. And while we may not be able to address all of them, I hope that we get to most of your questions in the hour that we have together. The speakers and the hosts may use the chat tab for extra communication if need be, so please keep an eye on that tab as well. The recording of the webinar will be available shortly afterwards on the nccph.ca website. In 2017, the National Collaborating Centers embarked on a joint project, all 6 centers, to understand better what is the role for public health, particularly for communities and individuals who have been evacuated for a long period of time, or the role of public health a long time after evacuation. So we typically think of the emergency cycle of preparedness, response, and mitigation, but we wanted to understand what additional roles there might be for public health beyond that initial cycle. We started with a review of literature. We asked a few key informants and found that replies were quite different across the country, depending on who was in place and the structures that were already there. So we were very delighted to contract with today's speakers to help us understand in more detail what it actually means for communities to be evacuated and to be coping with the effects of evacuation over the long time. Our guest speakers today are Dr. Lily Yamaglova. She is a Bashir woman with degrees in engineering and risk analysis and has a PhD in resilience planning. With over 20 years of work experience with government, NGOs, media, and Indigenous communities, and supernatural organizations in Europe and North America, Lilia is Program Director of the Preparing Our Home program that empowers Indigenous youth leadership in community resilience. We hope to be joined by Darlene Yellow Old Woman Monroe. Darlene is a Siksika elder born and raised in the Siksika Nation. She is the oldest of 10 children. Darlene has served her community through many roles as a community nurse, Treaty 7 Zone Director, Medical Services Branch and Chief. And in 2013, Darlene came out of semi-retirement to assist the Siksika Nation with the flood disaster as a night shift volunteer and became manager of Dancing Deer Disaster Recovery Program and project manager for Community Wellness Recovery Program. And thirdly, we are joined by Dr. Emily Dicken. Emily is an Indigenous scholar and practitioner in emergency management. She has over 15 years of experience and has held roles in organizations such as North Shore Emergency Management, First Nations Health Authority, and Emergency Management BC. Across all areas of her work, Emily seeks to understand colonialism as an unnatural and enduring disaster affecting Indigenous communities. When not working, Emily can be found enjoying time in the Coast Mountains with her husband, Jeff, and their 2 young sons, Keegan and Bowen. So I'm very delighted that we can go ahead. I hope that our technical difficulties are being resolved. Please remember that this will be recorded and the recording will be available afterwards. So without further ado, I'll turn it over to Lily and Emily. Thank you.
Thank you so much, Margaret. And maybe to begin with, I just wanted to thank the National Coordinating Centers for Public Health and the entire working group that worked on this project, the work leading up to the community-based work. Really grateful for the supports, the guidance, and the discussions that we had as part of the working group. So I will just start my slides here, making sure everybody can see. We're still hopeful that Darlene will be able to join us. I just left a message on her phone, so really hoping that she will be able to join us shortly. Welcome everybody. Today we will be talking about the long-term evacuations or displacement really in First Nation communities, and we will be providing specific lessons for public health. Just wanted to acknowledge everyone who's joining today. We're all tired from many different things, so thank you so much for finding the time to join. I'm joining you today from the beautiful traditional unceded territories of the Sinaiix peoples. So some of the really, Emily, did you want to speak to this first slide or do you want me to speak to it? We'll just go back and forth with Emily while Darlene is not here, so we'll just do it that way.
For sure. And so again, really thankful to be here. Today I'm joining everybody from the unceded ancestral territories of the Squamish Nation and the Lillooet Nation on what's now known as Whistler, British Columbia. And really thankful to be part of this research team with Lily and Darlene and to be really gifted the space and community to have walked alongside both of these communities during really traumatic circumstances and events. So it really, the heart of the context of this research really sits in understanding the colonial impacts that are tied to disasters and really understanding that the colonial relationship that many response agencies, whether it's government responders, from across all spaces of government, whether it's federal, provincial, neighboring local jurisdictions to First Nation communities, or whether it is the health sector as a whole, has a really significant impact on what that power dynamic with community looks like, especially during times of crisis and during times of natural disasters. And as a research team, we really nurtured that understanding and really set the context that really the historical underpinnings and contemporary space of colonialism that we're in right now has a huge impact on how Indigenous communities move through disaster displacement. When we honor that context and really understand that it isn't just about the evacuation that's underway at a given moment to a given event, that it really is coming down to colonial land dispossession, cultural genocide, forced displacement that's legislated by the Indian Act, but also forced displacement from acts like the Indian residential schools, the 60s scoop, and other experiences that Indigenous communities have gone through within the Canadian landscape that have really forced that that space of removal from community. All of those experiences intergenerationally are still at play in community. And so when we look at them in the context of disaster evacuation, it becomes essentially a compounding event within that community space. We also really began to unpack the fact that due to climate impacts, the frequency, intensity, and severity of events is becoming more severe. And to that end, it's becoming more severe in many First Nation communities and Indigenous communities that are under the Indian Act put on land that has a higher frequency and intensity of event. So there is really sound research that we were able to bring forward through this work where many Indigenous communities impact higher frequency and severity of flooding simply because within the Indian Act, reserves were placed on some of the most vulnerable pieces and undesirable pieces of land within this country. And even though they may, the reserve lands may sit within the traditional territories, it was often the land within that traditional territory that wasn't desired by, non-Indigenous or colonial neighbors that kind of forced this co-location onto reserve land. We also really began to explore housing inequity and infrastructure inequity, and really what that looks like in terms of the realities of creating healthy, livable communities, and communities that are really disaster resilient and resistant. And then really looking at what really all of the elements of crisis that come along with displacement. It's much more than just being evacuated from a community. There are huge economic ramifications that come with that, huge just cultural and family ties to community that become lost, and all of these kind of safety and security nets that really come when people are in community, nurtured in community, and supported from a harm reduction perspective in community to move through a crisis event. And when that safety system support network isn't there, there are many cascading financial impacts that come from it. So Lily, I believe we're over to you.
All right, sorry, Emily, I just touched the screen by accident. I didn't mean to advance the slide. Just wanted to echo what Emily already shared and share some of the statistics that we know nationally. So First Nations communities First Nation individuals living on reserves are 33 times more likely to be evacuated due to wildfires, 18 times more likely to be evacuated due to any hazard. And of course, probably a lot of you know that residential fire mortality. So you are 10 times more likely to die in a residential fire if you live on reserve communities. So the disproportionate risk is really embedded in the kind of two-tiered public safety system in Canada, right? So there is public safety for if you're off reserve and if you're on reserve. And as Emily said, the roots of that are deeply colonial in nature. So that's a lot to take in. I just wanted to pause for a second. And if people have any chat comments, please feel free to drop them in the chat. Reflections, we will definitely pick it up. But it's something that we thought would be important to share as context as we move into the next, the sharing of the research. So given the context and given the communities that we were working with, it was really important to us, the research team, to design a project that would really reflect community-based research approaches and Indigenous approaches in particular. So what did this look like? One of the methods that we used, and this is an ancient Indigenous method, and normally you would be trained for this for years and years to be qualified to do this in communities, was a sharing circle method. So in a sharing circle, everyone is equal, and the sharing circle is complete. So everybody can voice their opinions, the feelings, how they feel. Another Indigenous research methodology, we were really lucky to work with Darlene. So Darlene is a Blackfoot speaker. So when she interviewed elders, she spoke to them in the language that they trust and understand. And what's beautiful about doing work in Blackfoot, obviously there are many words that in no way translate into English that Indigenous languages have, right? So that's another kind of an aspect of cultural safety that was introduced. Another interesting thing that I think in this research, and something maybe for those who are considering research with Indigenous communities, when we were going into this project, there was an opportunity to support a community-based researcher. So Darlene, the elder, the former chief, the former medical director, the former community nurse, the former director of the Dancing Deer Disaster Recovery Center, that Siksika Nation felt she was the right person to do that, right? In Ashcroft, it was a different story where the community requested that an external researcher, in this case, Emily, comes and speaks to them. So it was this kind of more of a reflection exercise. So that is a powerful lesson as well. Communities can decide and determine which research methods works best for them. As you can see, there was a wide duration of interviews. And for Darlene in particular, each interview opened up a lot of thoughts and memories. So we were connecting with people 6.5 years after displacement. So there was this kind of almost a debrief, a healing session after each interview, and we are really grateful for that. Another important perspective was that we talked to evacuees and band members, administrators, and often these people, the staff, are also evacuees with lived experience. So the lived experience was really central to this entire research throughout the project. And another important thing I guess I should mention is we signed community agreements so that the data is shared and stored in communities and is used by communities the way they feel is important and is ethical, as well as the other ethics form that we filled out with the university. So I'm just gonna check, did Darlene join by any chance? Or not yet?
Just going to check with Zishan, our technician, but I don't think
Doesn't
she's
look
here.
like it. No, okay. Emily, should we try maybe go through your slides first and then come back in case Darlene has joined? Would that be good? Maybe
Yeah,
I'll
most
just
definitely.
forward.
Let's do that.
Yeah. Let's do that.
Perfect. Thanks for navigating that, Lily. And again, before I really jump into this, I want to just extend a huge, tremendous space of personal gratitude to the Ashcroft Indian Band. And really to a young woman named Shalyn Pigeon. She actually works now with First Nations Health Authority in an emergency management role, although I think she is beautifully off on maternity leave right now, which is absolutely wonderful for her. But we actually saw Shalyn grow exponentially through this work. So a little bit of a background. So I was actually introduced to Shalyn shortly after the 2017 wildfire season when I was working with Emergency Management BC in First Nation coordination. And Shalyn was the recovery manager for Ashcroft Indian Band. And as a young woman, I think, she was, I want to say maybe like 20, 21 at the time, very young, stepped into an insurmountable leadership role within her community. And instead of going off to pursue other professional endeavors, she chose to stay behind in her community and really support them through the recovery process. By the time Lily, Darlene, and I came to this project, Shalyn was navigating other professional avenues and really looking for ways to get more formally into emergency management. And when we started this research with her, she was still the recovery manager at Ashcroft. And over the last few years, we've seen her blossom into a profound leader in the space of Indigenous emergency management. And now she holds a poignant role with First Nations Health Authority. And so it's really wonderful to see kind of what these evolutions and field of practice look like. But she provided such a critical avenue to open the door for us and really to help bring the interface of community knowledge, and this space of academic research together. And without her support, we really couldn't have done this. So really just kind of raising our hands to Shalyn and everything that she's done in this project today. So really just kind of, oh, did you change that, Lily, or did I?
I did.
Oh, we pressed our button at the exact same time. It's amazing when that happens. And I thought, I've got control. So really kind of setting the stage for what this event looked like. This event was actually a poignant event in BC's wildfire history. So the Elephant Hill Wildfire up to that point was the most destructive wildfire in BC's history. It resulted in the loss of roughly 211 homes and structures, and more than 50,000 people were evacuated from their homes, with the fire claiming over 200,000 hectares of land in total once it completed its burn. The fire itself actually started only 10 kilometers from the Ashcroft Indian Band, and sadly, for the first few days of this fire, it was known as the Ashcroft Fire, which actually really created a lot of stigma for Ashcroft Indian Band members who fled the fire. And it wasn't until a few days later that the fire name was renamed as the Elephant Hill Fire. But already in those few days, it really left a huge mark and really negative imprint on members of the Ashcroft Indian Band. This Indian Band is really quite small. There's only about 333 members to this community, and many of them live off reserve. So as this fire started, it essentially, in the end, it ended up leaving 12 families homeless. And they were evacuated for a total of 18 months. Essentially, there were 9 single-family homes that were impacted by this, as well as a triplex and several maintenance buildings for the Ashcroft Indian Band. But aside from that, it was really, I think, the most poignant things to reflect on in the overview of this event was just how fast the fire claimed the community. Again, it's estimated that it was no more than 10 minutes from the start of the fire to it hitting the community and requiring immediate evacuation of community members. Lily, maybe do you want to go to the next slide, and I'll start to build a bit more on the context. So we really started to explore the depths of this research through the evacuee experiences. As Lily spoke to, we really centered the work on the evacuees themselves, having the narrative from their own words brought forward into this research. And for us, that was a really critical reflection of how we understood the public health impacts from the voices of the people who were impacted by this experience. Really, some of the most poignant facts that were brought forward were that there was a deep space of confusion and a lack of true accountability and emergency preparedness for the community. Some of you who are more familiar with emergency management may know that there are really significant jurisdictional considerations for Indigenous emergency management. When we think about jurisdictions and emergency management, very cognizant that for First Nation communities, there's a deep space of federal responsibility under the Indian Act and on reserve land. And then there's also the wraparound response support that often comes provincially in terms of disaster response. And then there's usually neighboring jurisdictions that will provide evacuee support depending on the scope and scale of an event. And so right away it came to light that there was a true lack of emergency preparedness in for Ashcroft Indian Band. It came down to the community not understanding the process for evacuation, and even many individuals in the community that held a role of responsibility not understanding what their role and function was during a disaster event. And in many ways, I think what you saw was natural leadership within the community. You saw folks that step into leadership roles within the community do just that. And the community really rallied around itself to get each other out of the community and into a safe place. But ultimately, what that led to was a really scattered response where community members weren't all co-locating. People were just basically fleeing for their lives and trying to get out of harm's way. I will say that as a testament to how the community responded, there were no deaths for this extremely catastrophic event. And the community actually took the time to really take care of each other. That said, because there wasn't a lot of organized support through the community, there was a lot of stress incurred through this event and mistrust during the actual tactical evacuation and the supports that were provided thereafter. It was really hard to figure out who was providing central sources of support, whether it was the leadership at Emergency Management BC or coming from the neighboring communities. And essentially, because that wasn't clearly communicated to the evacuees, and things were often changing through the process, it created a lot of mistrust for those that were evacuated, and they really weren't sure where to turn or how to get that accurate information. Additionally, administrative processes were extremely onerous. This is something that Emergency Management BC has done a lot of work on since 2017, and they've since transitioned from a paper-based ESS, like Emergency Support System Registration System, to an electronic-based system. But essentially, at the time, as a paper-based system, it required evacuees to retell their story multiple times, reliving that trauma, and really having to often feel like they were explaining themselves to try to get support. And it was really, from the evacuee perspective, I heard from almost every evacuee that they felt like it was a space of judgment. They felt that it was a point where they were being asked to rationalize what their experience was like to get the financial supports that they needed to transition through this evacuation process, and that it was coming at a deep space of judgment and criticism. Lily, can you jump over to the next slide? Perfect. This slide gets a little bit more nuanced into how we saw those public health impacts really come forward within the research space. One of the biggest things that each evacuee brought forward was that they experienced a worsening space and a lack of continuity with healthcare. If many of you are familiar with the healthcare system for Indigenous people in BC, FNHA plays a really prominent role. That said, some of the systems and structures within FNHA were in 2017 still really finding their feet with emergency management. Since 2017, FNHA has really built out the depths of how it supports communities through disasters, really specifically through evacuation processes. And a lot of this has to do with how the Ashcroft evacuees really moved through this event, and some of the things that were brought forward in light of the circumstances. So what we did see through this research was that it really was challenging for whatever reason for every evacuee, and it was so uniquely different to every evacuee, but they all stated that it was very hard to navigate accessibility to the healthcare system. Each of the evacuees that we interviewed all had some element of pre-existing health considerations, whether it was accessing supports for mental health and addiction services, whether it was other kind of long-term sustained health experiences, but all of them had kind of this pre-existing connection to the health system that was really hard to knit together, both during the immediate space of evacuation, but also during the sustained space of evacuation. One of the things we also noticed, and I think this, it wasn't necessarily verbalized by each of the evacuees, but we were really able to understand that there were deeply unacknowledged spaces of vulnerability and increased elements of risk that came up for all of the evacuees. We really looked at vulnerability through the lens of the social determinants of health and really began to unpack, access to employment, access to income, access to safe housing. And what we saw was deep spaces of these vulnerabilities being exacerbated. And perhaps that goes without saying, but I think academically and from an applied perspective, even though we know this is the case during the disaster recovery landscape, I think that there's still so much research to do within this area to deeply understand what increased vulnerability and risk look like. We saw really significant issues concerning unreliable lodging and the impact that that has on evacuees. One small point that I'm going to bring forward, and there were many with regards to this, but one small deep impact was that evacuees were sent to the closest lodging. The closest lodging had one restaurant tied to it, but the restaurant was a pub. And what we saw, what many of the evacuees stated was that substance abuse and addictions really went through the roof. Thinking about it from a harm reduction perspective, for folks struggling with addictions, there was really no safe place to eat outside of this pub-based setting. And it really led to really difficult choices for many evacuees with regards to what that risk threshold around addictions looked like. We also saw really lingering grief and loss. So even when we conducted the interviews, everybody was back home, and yet the trauma and triggers were really insurmountable for many folks going through this interview process. We saw really deep spaces of grief and loss, and a lot of trauma that was still very much at the surface, even though some folks had been back in their home for almost a year. Lily, can you jump to the next slide? We recognized a few deep learnings in this, that trauma and isolation really need to be considered during evacuation processes. When people are evacuated out of their community, they really lose deep spaces of connection, culturally, family connections that are really relied upon. And when folks are evacuated to a hotel, often that can lead to deep spaces of isolation. What we saw from a number of the evacuees was that isolation really grabbed hold, and instead of connecting with family and connecting with community points of connection, people were really kind of isolating themselves from being truly and intimately connected. And this was really kind of a negative feedback loop that became quite perpetuated. Transportation was an ongoing issue for evacuees, and it really led to, I think, why that isolation took shape in the way that it did. Again, because people were evacuated outside of their community and not evacuated even into another Indigenous community, it was a neighboring municipality. What we saw was that it became really challenging for these evacuated community members to get back to their community on a daily basis and really access what those community-based services look like. Because for many evacuees, those services weren't being provided at the place that they were evacuated to. They were being provided back in the community, especially as the recovery process unfolded. Again, I do think, from a public health perspective, really such a critical element to understand that came up time and again for us in this research was increased substance abuse and addictions. It was much more than just the placement of evacuees into the hotel that had been identified. There were a number of other circumstances that went into this space of increased substance abuse and addictions. One was the provision of gift cards or Visa gift cards. During the 2017 wildfires, there was a very sizable transfer of funds to a non-governmental organization that was brought in to provide really critical recovery support. And in many ways, the recovery support they provided was deeply exceptional. But through that recovery support, gift cards were often provided to evacuees, and really to enable evacuees to get what they needed. But due to some other limiting factors, like evacuees being, as people were removed from their community and removed from community services that were traditionally provided around substance abuse or different public health kind of pieces of fabric that were part of the community, there were often choices that actually led to some cascading downfalls around substance abuse and addictions. And as those addiction rates went up, because the community was grappling with so many other elements of disaster recovery, there really wasn't this compounded support that was needed to address addictions and substance use. And so the community really needed some enhanced supports around that unfortunately didn't manifest. And so the issue kind of fueled within the community. And then just generally unhealthy living conditions. So when we really look at what healthy living conditions look like for individuals, living in a single room hotel structure for a given period of, the better part of a year would not really be considered a healthy living situation, especially when an individual is likely used to living in a multi-generational home, being able to spend much of their day out on the land. And now they find themselves in, a community that is not their own, living in a hotel without access to cooking facilities, and being reliant on a food base that isn't traditionally part of a healthy diet for them as a community. So there were many circumstances that went into what that experience looked like. Lily, next slide. Some really critical insights that we did walk away from, really specific to public health, is that for many First Nation communities, actually I'll say all First Nation communities and Indigenous communities know what health and wellness in their community look like. There are really distinct cultural ways to find that space of health and honor healthy living and lifestyles. And when the community is able to center that perspective on health around what works for them, it has immeasurably positive outcomes. That said, it requires us as practitioners to take a moment to step back, perhaps slow our process, and really meet the community where it's at. It may mean that through those conversations, we need to walk through unpacking the power dynamics within our relationships, the trauma dynamics within our relationships, and the colonial dynamics, but ultimately it leads to much healthier outcomes. We also found that psychological well-being and health impacts are incredibly important to acknowledge. I've learned, I think, one of the most poignant things I've learned through my career is that you really can't lead with trauma. If you're navigating your own trauma and you're not dealing with that as a practitioner and as a leader in your field, it makes it really difficult for you to go into a situation where others are navigating a really traumatic experience and provide, I would say, the appropriate support. It is so deeply important that we acknowledge that trauma is alive in the communities that we're supporting and serving. And we really understand that what we're facing on that day is just a small bleep in time for something that likely needs to be acknowledged in a really compassionate way. And perhaps one of the most important things that we've learned through this work, and this extends well beyond the work with Ashcroft Indian Band and extends into so much of the work that Lily has been leading in such a beautiful way with Indigenous youth from all across the country, is understanding that preparedness and recovery planning needs to be done through an Indigenous lens. When we think about what Indigenous resilience looks like, it gives us the tools and the wisdom to think about preparedness and recovery planning in a fundamentally different way. When we think about preparedness and recovery planning only from, a practical way of, the way that emergency management has been institutionalized and exercised within all levels of government or governance, it really doesn't acknowledge the resilience that's held within many First Nation communities. And when we center preparedness and recovery around the wisdom, knowledge, and capacity held within Indigenous communities, what we see is powerfully different outcomes where the community is serving itself in a resilient way. And that's perhaps probably the biggest learning and most beautiful learning that I've ever come across as a practitioner. So Lily, where are we going on that? I believe that will be the final slide as we swing back over to Darlene's work.
Yeah, I'm still really hopeful that maybe Darlene will join us on an hour, although I left 3 messages now. There is probably, in fact, a crisis that happened in the community, and that is, as Emily said, this is just the tiny little view, right? Darlene not being able to make it today of the things that people have to deal in their lives daily. But I was wondering if we can just take a moment here and pause and maybe hear from people some of their reflections. It's a lot to take in. Emily, I was really moved by what you said in terms of dealing with your own trauma, right? Like, and for practitioners working in Indigenous communities, what that looks like. So maybe offer any reflections that are coming to people. It can be done through Q&A. Margaret, I don't know if we have even capacity to allow people to unmute people and allow them to speak. But if we can just
we don't because of the way the setup, but is by all means use the question and answer. And one question that came to Emily was a question about who these, when you first mentioned them, who were these service providers that community members were finding such a challenge to work with?
So I'm being a bit cognizant of just being mindful that okay, I'm going to preface this by saying that I do think that all community service providers during a disaster are there for the right reasons, providing the services that they feel that they can best provide at any given time. And I know as a practitioner, nobody goes into this work thinking that they want to do more harm than good. And so I know that even in my work right now with North Shore Emergency Management, we have a lot of work to do in terms of creating a trauma-informed practice and culturally safe supports for all members of our community. And in many ways it takes a long time to create societal and organizational change. But when we think about disaster response back in 2017, from the Ashcroft Indian Band perspective, when we talk about service providers, we're really looking at the emergency management services provided by Emergency Management BC, who held the jurisdictional responsibility to provide disaster response and recovery support, as well as support through their ESS, their Emergency Support Services Program. From a health perspective, FNHA was at the table providing public health specific supports. The Ministry of Health was also at the table, as well as the Interior Health Authority. We then had a number of community-based organizations and non-governmental organizations from the Red Cross, the Salvation Army, Mennonite Disaster Services. There was quite a laundry list of people coming. We have to remember this was probably the largest, most significant disaster event that BC has had in recent history. And, you know, at the time, I was probably about 13 years into my career. I started just after the 2003 wildfires in BC, and I had never experienced an event like this in the history of my career. So, and in the grand scheme of things, even though we had a really significant wildfire season in 2018, I can't say that I've experienced another event like this. It was something that really caught us off guard from the perspective of a field of practice, because we really weren't used to dealing with major catastrophic events, especially multi-jurisdictional catastrophic events on such a large scale. So I hope that answered your question a little bit, but I'm happy to dig in if there's a bit more.
So we do have a further part to that question. I'm watching the time as well. So we can come back to the question or we can answer it now, depending on the other things that you want to share.
I think since it flows really well with this question, it would be good to answer it now. And
okay, so the question from Kellyanne Melosh is, what more importantly, will the providers be told about the feedback in order to better their services?
Really interesting. I think when we look at the series of after action reviews that took place following the 2017 wildfire season, a lot of this information was brought forward, and we've seen a lot of change. Essentially, cultural safety and humility training is now, I wouldn't go so far as to say it's a professional requirement, but every single service provider that provides disaster response in BC is now proactively taking cultural safety and humility training as part of, their core mandates. They're all doing it in different and unique ways, but I actually think that's better than having, a blanket service provided on cultural safety and humility. In some ways, I would look to Margaret and her team, and also the communities in terms of how this information is shared back. We're always really cognizant of what the public facing engagement of this work looks like, and really having the nations be able to speak for themselves in a way that works for them. So happy to really explore other forums and avenues to make this publicly more accessible and available. But I would say, if I was to think about the biggest change that's taken place in the disaster landscape in BC, I would say that it is the access and opportunity for cultural safety and humility training in all fields of practice that support communities.
Thanks, Emily. I'll turn it back to Lily now for the remainder of the session, and then we'll go back to questions as well.
Thank you so much. Can everybody see the slides?
Yes, we can.
All right, wonderful. I was just looking at the participant list, and I just want to thank somebody who is joining today, Laurence. So Laurence, I believe it was you who did a lot of the statistical work with Indigenous Services Canada, or it was called differently at the time. So just how important that knowledge base is, and what difference it made in terms of budget allocation and planning for evacuations to be part of the budget line and to do things differently. So I think as practitioners, we hold power to work in an evidence-based way. And Laurence, I believe it was one of the earlier stages in your career. So I just want to uplift and celebrate similarly how Emily did Shaylin. There are amazing people doing incredible work, and that's really inspiring. So thank you for that. Okay, so I will not do justice to this. Unfortunately, Darlene is unable to join. So Margaret, perhaps for the public version, we could even maybe retake and record Darlene sharing the story. But I will try to walk us through, since I've worked with this community for many years, over how many years, maybe 7 or 8 years. So I'll just try to touch the surface of what happened. Probably many of you remember the Calgary floods and Southern Alberta floods of 2013. It was in the media. It was at the time before the BC atmospheric river events, one of the most expensive disasters. So at $6 billion, only part of those were insured. Really massive event. Less coverage in the media that was around impacts in Indigenous communities. Siksika was particularly hard hit. So you can see here, it's in the valley. The houses were flooded out. There were about 1,000 people evacuated, and it's about 1/5 of the community that lives on the reserve was evacuated. So just think about this, the town, the city that you live in, and imagine 1/5 of your community picking up and leaving for up to 5 years. So this was really long-term displacement. Houses, many different houses were impacted. There are numbers in the case study, as Margaret directed, and the team directed you to the specific numbers and the impacts. So this was a really large, significant event. Also important to understand that bridges were destroyed. There was a lot of critical infrastructure that was destroyed, which completely isolated some communities from services, including health services and so on and so forth. Darlene was very careful in picking the people that she wanted to interview for this project. So these were the elders. These were people with pre-existing medical conditions. These were people that were taking care of vulnerable community members or had children with special needs. So we really looked at the spectrum of experience of people that really suffered the most in this event. And often these were the people that were displaced for the longest time. And when I say longest time, at the time of the interviews, it was long, 6.5 years. And some people still were not back at home, still moving around, still living in away from the reserve and so on and so forth. So the impacts were tremendous. As we walked through the kind of the communications challenges that happened in the initial stages of events, there were many. And this is something that I think if you read any after action event, the first thing you always see is communication, second thing is communication, and the third thing is also communication, right? So they weren't kind of age appropriate communication. So if you put out information on Facebook, it wouldn't necessarily reach the elders, right? So really having this kind of multimodal communication pathways is critically important when life safety is at risk to this extent. It wasn't 10 minutes as in Ashcroft, but again, it was a fast moving event. It's a very large community, so there wasn't a way to notify, there wasn't an early warning system. So there were a lot of those challenges. Similar to Ashcroft, the disaster brought incredible negative health impacts and deaths. Unfortunately, they didn't happen right at the event, but as the time picked up and moved on, the long-term impacts were really significant. Chronic illnesses, cardiovascular, there was a whole issue of diseases that really kind of picked up and claimed some people. At the core of it was this deep stress. People were incredibly stressed and lost. There was an uncertainty, what's going to happen, when are we going to move from one place to another. When the event unfolded, people first that were evacuated, they moved to the higher ground, some of them in RVs or teepees. Then they were placed, as the weather started getting cooler, they were placed in hotels. After the hotel moving around happened for a while because some hotels weren't, for example, didn't accommodate people with disabilities. So that had to be navigated. So there was a lot of moving and transition over the time. In fact, about 5 phases of displacement when we looked across the evacuees experience, how they moved from RVs and teepees into the hotels, then temporary, then ATCO trailers, which are this resource-based environment kind of, they're built around single guys in labor camps, so really not suitable for families, and then in the new temporary neighborhoods, and then finally home. That's the spectrum of kind of mobility across. The impacts were really uneven. So as I mentioned earlier, for people with disabilities or chronically ill or single parents or elders, it was a lot to deal with given already ongoing issues. Very similar to Ashcroft Indian Band, substance use, lateral violence, all of this went up in part because the accommodations that people were put in no way reflect the traditional lifestyle. Throughout every interview, we really heard the main theme was the significance of home for identity, security, and belonging. And when you lose that home, what happens with all of that? That discontinuity, that kind of separation and detachment, which then goes into this cycle of isolation. As one mother here shared, it was my sanctuary, my home, where I raised my children. The only thing I had was my vehicle and what we could pack in the vehicle, and then we left. So I had to start all over. Another parent here shares, my child has Down syndrome. My children are used to a lot of structure. The flood threw us out of our routine. It was stressful for them, stressful to teach them and help them understand that we don't have home anymore. So these are the conversations you would need to have to, after school, picking up your children. No, we're not going home today. We're going to somewhere else, over and over again. So these are the ATCO trailers that I talked about, and you've probably seen them along the resource lines development. So in no way they're designed around health or community or multifamily arrangement or children. So as one person said, I just felt like I'm in prison there. There was a pass system, there was a curfew. So literally it was a bit of a prison experience for people living through. They couldn't cook, their refrigerators, they didn't have refrigerators. So there were many, many numerous issues. Similarly, its environment entirely unsafe and not fitted for children. As one person said, my children are not safe. Their rooms are down the hallway. Therefore, we must constantly ensure they're safe. And finally, for Darlene herself, who is a residential school survivor, to hear these words, it's like residential school all over again, regimental environment. So just imagine, right? You're living your life, then you're grabbed, you're put on buses or something else, you hauled off into this big sportplex, you put on cots. So it really re-traumatizes people to that deep held trauma across generations. And that's something that word surfaced a lot. As Emily said, trauma and isolation in these phases of completely inadequate temporary accommodations. Transportation, similarly to Ashcroft, was a huge issue. For youth in particular, they were basically, because of the bridges were out and there wasn't dedicated transportation, youth were stuck in their homes with nothing to do, nowhere to go. So again, overdoses and all of these issues that came up with that, substance use, domestic violence, and just the multiple phases that things change over and over again. People had to repack and start all over again over this 6.5 years. So going from teepees and RVs, as I said, to kind of hotels, bouncing around hotels, then to moving to these outdoor trailers, then the new temporary neighborhoods, and then home. And still, an important thing here to highlight is while the homes came, they were moved outside of the floodplain, which makes sense, right? You're reducing the flood risk, making sure that doesn't happen. But then they were placed on a busy road and intersection, leading to other risks, cutting across the kind of community, disrupting clan structures. And this is something to really think about, the long-term planning that needs to go pre-disaster into this kind of relocation process and what it could look like. So that when you're pressed for disaster and I'm really rushing, what are some of the options? How could that be negotiated? That's not Siksika specific, but in general, some things that something to think about.
Just so you don't feel too rushed, Lily, if for those who can stay an additional half hour, we can keep the webinar open.
Okay, all right. So I just want to, if we have to finish it, and for those who have to go, like I just want to highlight the incredible Dancing Deer Disaster Recovery Center. So this is the work that Darlene created. And I'll just tell briefly Darlene's story. So she came out of semi-retirement when the flood happened. She was an evacuee herself. She just went to volunteer at one of the big sportsplex buildings. You know, she was invited as a night shift volunteer because they didn't have any. So she would just clean the rooms and help some people, especially children who had ADHD or had hard time in this environment. She would just spend time with them. And then they realized we have to do something bigger to help our own people. So that's how Dancing Deer Disaster Recovery Center was created. It has deep spiritual meaning. And this center was the idea that Darlene had for it actually came out of Philippines. When she went as health director, she went for a visit to the Philippines. And she found out that there was this amazing center that actually went and visited people in their homes, providing multidisciplinary services in their homes. And Darlene always tells the story how, you know, they were climbing this mountain with these medical workers to reach people, and they're all just wearing flip-flops. And Darlene is walking and thinking, if these people are doing this much, we can do a lot more in our communities. As I said, it was a really unique institution. Why? The services, they had Blackfoot speaking people. They had multidisciplinary groups. So they had people who engaged with youth. They have people who looked after elders. They had nurses. They had incredible group of community mobilized services that were delivered through this one center. And as one of the service providers, I'll just read this quote to show the depth of the services that they provided. Meeting the people in their own homes, their temporary situations, people were much more open to be seen in their own comfort. For the most part, it allowed for a lot more trust building that people would be willing to open their doors to you, to be able to be seen in that situation, you know? I think it was more of a cultural thing. Rather than them seeing you as a psychologist or as a professional coming to do counsel, they saw me more as somebody coming in to visit and checking in on them. It's a much safer, non-intrusive way. really creative ways as well. There were women's sharing circle with beading sessions. So there was multiple cultural activities similar to Ashcroft that were provided in a culturally safe way, led by community members. And in a way that I really hope every community in Canada learns from Dancing Deer Disaster Recovery Center, because having worked with many communities, I haven't yet come across this incredible model. But I also want just to caution this, we use this word recovery. Darlene always says recovery is really uncertain and some people have never recovered. It's just not an option given everything they've been through and are continuing to be through. Some of the really positive things that came out of this work were really age-appropriate services and very culturally safe. So, and they worked with service providers too, like Save the Children and so on and so forth. So really child and youth focused recovery activities. Some people didn't recover. So every time there is a bit of inclemental weather, people rush to the door thinking, what's happening? You know, is it coming back again? So PTSD, anxiety, negative health outcomes, and death, those were some of the outcomes. Disrupted plan structures, as I mentioned as well. The community is safe from floods, but the structures have been, well, resettled, some of the resettled communities anyway. And there were numerous issues with new housing. So houses were placed on a land that was that was contaminated from pesticides. There were windows that were installed backwards, many issues. There is always a trade-off between speed of recovery and the kind of the quality that goes to it. You are trying really working hard. People were working really hard to get people into homes, but it comes at a cost, right? And then, of course, the big lesson is that recovery supports were terminated before the community recovered, just because how extensive this event was. So something, again, for public health practitioners to think, what do long-term public health supports for displaced people that goes beyond the kind of 1 year, 1.5, 2 year cycle? What does that look like, and how can people access that? So Emily and I just, we have some recommendations left to share today, and then we'll open to any questions that there may be. Or should we take questions first? I'm open to either approach.
Thanks. I think it would be great to see the last of your slides, and then we'll have that the rest of the time together.
Sounds great.
Perfect. I'll take over this first series of slides here. So really, this is really about bringing those recommendations to practice. So how do we bring the learnings from this research to life within a public health context, within an emergency management context? And the number one thing that we really wanted to bring forward was that it is so critically important to understand the continued impacts of colonialization on Indigenous people within the Canadian context. It is so critical that all spaces of emergency management, whether it's health-related emergency management, whether it is other spaces of emergency supports that are provided in community, all really embrace cultural safety and humility training, anti-racism training. And honestly, I've seen such a poignant shift in BC. I can't speak for what this looks like across the country, but I can say with absolute certainty that when I look at the landscape in BC specific to emergency management, whether it is health or non-health related, there is such a significant uptake in cultural safety and humility training and understanding how emergency management processes and how work with relation to disaster response embraces cultural safety and humility training. Another really significant component to this, but I don't see it moving at the same pace, is really bringing in trauma-informed care and practice into the work that takes place in First Nation communities. This is much more nuanced and specific than just cultural safety and humility training. This is really about how we wrap around communities that are in deep spaces of crisis and how we do it in a way that doesn't create further harm. I will say that I do believe the medical profession in Canada, specifically in BC, is embracing trauma-informed practice and care within its practice, but I don't see the same thing within other spaces of public safety. So it's definitely some work that needs to take place. And maybe it is Indigenous health that helps lead and shape this work for the broader spaces of emergency management. The last point that I'm going to make before I turn it over to Lily is really creating clear and transparent and timely lines of communication. This was the biggest thing that came out of this research, was that the evacuees didn't feel like they were spoken to, that they were informed, and that they were included in what the communication looked like from all spaces, whether it was the community space, the service provider space. And it's really important that that information is provided through a whole host of avenues and is provided in a clear and transparent way. So I'll turn it over to Lily for further recommendations.
Thank you so much, Emily. So this is, again, as Emily said, there are spaces of hope that have happened. Emily, I guess we've been in this maybe 15, 18 years now, maybe. And some of them are the way the evacuations are done, right? So now there is actually, for example, even spaces for land-based evacuation where people are allowed to go on the land instead of being evacuated into the cities in places where they experience racism and so on and so forth, right? So providing these opportunities for First Nation evacuees to participate in community-based, culturally safe land-based activities where people can come together with elders and knowledge keepers, it's really, really critical. So that's one point. And there's been change on that, which is wonderful to see, some change anyway. Food is so important. And we know that in every food is medicine, right? So the way the meals are arranged, like the pub story that Emily shared, how they arrange, what community gatherings look like, what type of food is provided, right? And for what different groups, that takes into account the health considerations and so on and so forth, really critical. And it's what brings people together. It's something that helps people heal. So tremendously important to have that as part of your budget line as you do public health, for example. And then this notion of wraparound, and we talk about that a lot, right? But what would mobile crisis response and recovery support teams for First Nations evacuees would look like if we were to implement them throughout the multiple phases of evacuation? And what would it take to make sure that these positions are staffed by Indigenous community members from those communities, right? There are some exciting examples that are happening across Canada in terms of Indigenous peoples taking control and kind of in a self-determining way, creating this crisis response units. So that's really important to think about as well. Emily, did you want to talk about this ones or do you want me to cover them? Open to either. This was Darlene's slides. We were really hoping she would close us off in a good way, but whichever way.
I'm super happy to speak to it. So really it is definitely ensuring that evacuees are provided with service provisions that speak to the languages that they speak, whether it's making sure that it's written in plain language for those that are struggling with literacy, or better yet, that for those that are traditional speakers, that it is translated into traditional languages. We saw like such a beautiful opportunity within this work for Darlene to lead her work in her language. And what we see is that there's such rich engagement, especially from elders, when we start to really have our work embraced within that community context and language-based context. As a non-Indigenous speaker, it can be really hard to facilitate that space, but that's when you really create the capacity within community, honor the knowledge speakers within community to have a voice within the work that's going on and to be compensated and lead that space of work within community. Again, it's really implementing the culturally appropriate outreach and supports to Indigenous evacuees, making sure that when service providers are going out into community and into homes, that they're doing it and they're invited in a culturally appropriate way. Are they following community protocol? As a non-community member, do you know what those community protocols are? For many communities, they want to embrace service providers that want to provide their support in culturally safe ways. And many communities know that they need to kind of shepherd that community protocol along. And so if you are out in community and you're not sure of what the protocols look like in that community, try to connect in before you arrive and make sure that you're providing the services that you provide or the supports that you provide in a way that honors those protocols and what that looks like. And it will look different for every community. It will look different for every family sometimes too. So when you are working at that household level, tread gently and recognize that it can take a long time and a lot of engagement to really understand what that household, family, or community protocol looks like, and that you may need to be really adaptive as you're working towards those services. And again, this kind of ties into this is recognizing that every community, every family, every household has really unique and distinct cultural beliefs, practices, different ways that families are coming together, and a really diverse set of needs. It's not a one size fits all. And although there are some universal and guiding principles around working with First Nation and Indigenous communities, you can never make the assumption that those guiding principles will remain universally true. And so one of the things that I think I've learned a lot through this work, but just through life, is that it's you never want missteps to happen, but sometimes they will, and just approach things with deep humility. And when you approach things from a deep space of gratitude and learning, the community or family will often open that space of learning to you, and you can really kind of walk hand in hand through, whatever adverse experience you're moving through together, and really provide that support in the way that works for the family and the community. And really, when you're in community, when you're working with a family, always deeply engage that lived knowledge, worldview, experience that whoever you're working with holds central and true to who they are. Oftentimes, when we're moving through work that's tied to disaster response or emergency management, it's often template-based work. And so people often want a plan to address a certain event or a process in place. What we find is that in order to provide that service or support in a culturally safe way, it needs to be really nuanced and adapted to recognize that there is a deep space of knowledge and capacity that sits within community. And when you center that support around community, it really has deeply favorable outcomes for how people move through events. So I wish that Darlene was here to speak to that, because she does such a much more beautiful job than I ever do with that piece.
Maybe I'll just briefly share as we close here one teaching that Darlene always shares with youth in our gatherings is using all of your senses. And I think this is particularly important for public health. So there was a story in the early stages of evacuation when she was a volunteer at that sportplex. There was this man that was always in the back in a cot and kind of not participating the same way. And Darlene always would check on him, how are you doing? But he was kind of grumpy and not always answering. So one time she just smelled something off and she's like, you know what, just take your sock off, right? So he took his sock off and his foot was in the early stages of gangrene, right? So they got him on the hospital, they got him to the service that he needed. So that powerful teaching of using all of your senses As Emily said, centering on lived experience, these people are experts in the situation they're in. They know what works and what doesn't. And coming to it from a kind of asset-based approach as well, looking what's working really well in communities and working with that before trying to institute the kind of the bulldozer of recovery, because it's a deeply traumatic space often. So those are just some of the parting thoughts that I thought it would be good to share. And there was a comment made by Kellyanne that we need to work with Indigenous communities during emergencies when our communities are being displaced. Fear of the unknown is the biggest factor. Two-way communication, working together to safeguard the community is key. Thank you so much, Kellyanne, for that beautiful sharing. Absolutely. Thank you. I'll stop sharing now and we can have a bit of a Q&A as well as we wrap up.
Well, thank you, Lily and Emily, so much for a very profound and moving presentation. Everybody was riveted. Everybody's still here. So that just says, speaks to the significance of what you had to share. The Q&A tab is there for we have time for just a few questions, but I have a couple that have occurred to me. Emily, you mentioned early on how the many jurisdictional lines there are in emergency response. And so based on your experience and your knowledge and what you've learned from the communities, what can public health learn about the entry points for their involvement, especially after the usual emergency response cycle?
Yeah, I would say, I hope I can answer this succinctly. I think that public health really needs to find its space within the emergency management structures formally. I see this happening more and more, but I'll provide maybe an example that I see is unless you have a space at the table, it's really hard to have a voice. And I mean, the same can be said for Indigenous communities within this work. We know that when we have Indigenous voices at the table, it changes the outcome for the communities that are impacted. I would say the same for public health as a broad community is how do you sit at the table? How do you sit at your local tables, your regional, your provincial, national tables with regards to disaster response? And we all work, whether you love it or hate it, emergency management is all primarily based off of ICS structures. And ICS structures are basically an org chart that identifies who is at the table. And I work on my day job, I work in a municipal setting where we actually have a seat carved out for health. And when I think about who fills that seat, my preference is that it is the space of mental health. And my preference is that it's usually somebody that comes from in BC, what we call the disaster psychosocial program, because I know that when my community is impacted by an event, that's the biggest challenge that we face. And so, whether it's the disaster psychosocial team that's occupying that space, whether it is Health Emergency Management BC, which is often a very good conduit to the broader space of health, we really need to see health represented at those tables. And often I think if communities haven't been through major events, they may not know how critically important it is to bring health into that space of response. And so when you're moving through an event where you see a role for public health, carve your way into that space of response, because otherwise, whether it's a good thing or a bad thing, the response is always going to move forward. And if we don't have those expert voices at the table, it moves forward without that perspective.
And even after response, the important point, what happens after, right? As we've seen, it's like, okay, so there is the response, there is the immediate recovery when supports are more available, funding is more available. But what is the role for long-term public health, especially when we're talking about communities being relocated to contaminated sites? That is where I think public health could play a huge role, right? Like actually having a proper environmental assessment before these decisions are made. So And as Emily said, it's critical though to have these relationships way before the disaster strikes, because the recovery bulldozer, it'll shove over everything that's in its way. Like it's also colonialism on steroids. External organizations come in, they take over. So very important to build those relationships way in advance. And the other important thing, first I want to acknowledge everybody here who's on the call today, the past 2 years and how difficult it's been, but to what prominence, like public health is in the spotlight right now. Claim those spaces that rightfully belong to you. When we did this research a while back, I honestly think things would be different. We would hear some different potentially stories in terms of, especially for professionals, right? So claim those spaces that belong to you in managing emergencies, whether it's long-term marathon emergencies like COVID, or the inevitable wildfires and floods that will only exacerbate in scope and duration and displacement, right? So I just want to thank everyone who has been doing their job and just say, step up forward, because there is a huge role to play. There are many gaps that have been identified where their public health leadership would have really helped.
Thank you for that. And an additional comment has just been raised by Kellyanne again. Thank you for that as well. And we're in that time of public health renewal. So it does seem like the time is now to, as you say, claim those spaces. Just one last question for you both before we close. Can you tell us a little bit about how the information that you gathered with community has been shared back with the community and what has happened with that?
Lily, did you want to start?
Sure. So Darlene did an amazing job where we printed the report, and the reports were taken to each and every one of the participants. The reports were also presented to the band office. So there was a really strong reciprocity component, and that was really important. And the feedback that Darlene heard is that we feel seen. We feel that we weren't forgotten. So for evacuees to even have this story shared and living somewhere beyond their kind of their home and their daily life, that meant a lot to them. So again, Darlene would be way better to speak about that, but that reciprocity, again, from the kind of the ethics of community-based research, Indigenous research, is really critical component.
Yeah, and just to echo that, we when we did complete this report, we were very graciously actually provided with so many printed copies. And so in the same vein, at the Ashcroft Indian Band, the copies were taken actually by Shallon back to the community, and they were delivered to each household and member that participated, in each evacuee that participated in the research, as well as provided back to the band office. I will say too, one thing that it didn't quite come forward in this presentation, but I think it's really important to acknowledge, is that there's so much anxiety, seasonal anxiety, tied to the experiences of the evacuees. And in retrospect, in some ways, I had wished that I had had more insight into that when I did this research. We did this research almost on the anniversary of the event happening. It was actually just prior to the event happening, 2 years out. And there was so much anxiety headed into the anniversary of that event, and just even kind of the seasonal warming that was happening, that the conversations are so triggering around this event still for the community. And I'm, in some ways, I would love to share this research in a deeper way with the evacuees and really do more work around sharing the information back beyond just providing the documentation back, but really making sure that they recognized, just how valuable the insights and wisdom that they provided was to the learning. But even reflecting back on this is still so traumatic for the community that I'm not sure at what point it becomes easier. And in many ways, I'm kind of like Lily. I remember reflecting back on, oh man, how do we bring the words to this presentation? Thinking that so much should have changed. And yet I feel like we go through these same seasonal disaster cycles, trying to make changes, and the changes are coming, but they're slow. And so, you know, are we doing service, and does it look the same? And I'm not totally sure. But I do feel like from the context of this work, just being mindful that the experience of 2017 and the evacuation following, it was captured, the people, the voices were heard, the voices were honored, I think is incredibly important. But I guess my wish would be that as we revisit these discussions, sometimes I worry that not enough has changed. And if the same event was to play out again, that unfortunately, I think we might see somewhat similar circumstances. And so I think for all the sharing and digging into those traumatic situations, I just hope that more changes as we bring these forums to light.
And that's a powerful point. I think in any disaster scenario, as a practitioner, just reflect who is benefiting right now. I have my job, I'm making money. That kind of the political economy of suffering that takes a hold in this kind of evacuation scenarios. There's big money being made by hotels, evacuation shelters, vouchers, and so on and so forth. Always keep in mind, like, who is benefiting and who is suffering. I think that is really important to really center on the lived experience and how is that changing. So I think that's really critical. I was just in a session earlier this morning on national risk profile with Indigenous youth, and they were speaking how unsafe sheltering in emergencies is what led to severe overdose crisis, because crystal meth was the only way they could feel safe in this environment, right? So really creating safer spaces, that's, I think, the where a lot of effort could go to. So thank you so much for today, Margaret. Thank you so much for holding this over so many years. So very grateful for the space that you created and the team, extending it to the broader team. Angela, I think, Lydia, I don't remember all the names, but thank you to the entire team as well.
Well, thank you both for presenting today. Clearly work is still to be done, and obviously tremendous interest from your colleagues in emergency operations and also from public health. I want to thank you both again. Our great thanks as well to Darlene. I'm sorry she could not join us, but we know how much work and love she put into this project. To all of you who stayed with us, thank you. I'm sorry about the early technical difficulties, which I think we've mostly overcome. There will be an evaluation that you'll see either pops up on your screen or will be sent to you. Please take a few minutes to fill that in. And lastly, my thanks to Zishan Cutter for pulling this all together for us and making it all seem so smooth, I hope, on the outside. Miigwech, thank you all.